This is a CJSON podcast, and I am Ranveer Brar from the Chronic Disease Innovation Center at the University of Manitoba, Canada. I am delighted to have the opportunity to share the results with you on behalf of all the investigators. Most physicians know that frail patients have worse outcomes, but the best method to diagnose frailty and the agreement between the different methods remains unknown. In this study, we explore the agreement between objective and subjective frailty and physical function assessment tools in patients with advanced CKD. We were also interested in how these measures agreed and how they impacted the decisions between nephrologists and patients surrounding dialysis modality choice. Our study included 603 patients enrolled in the Canadian Frailty Observation and Interventions Trial, CANFIT. CANFIT is a multi-center prospective observational study examining the longitudinal trajectory of frailty and its association with adverse health outcomes in patients with advanced CKD. Our objective assessment of frailty was the Fried criteria, which is based on 5 domains: weight loss, exhaustion, low physical activity, slowness, and weakness. To obtain our subjective frailty rating, we asked the clinical nephrologist and kidney health nurse to independently rate each participant's level of frailty on a 5-point Likert scale by asking the question, on a scale from 1 to 5, 1 being very fit and 5 being very frail, where would you rate the participant? Physical function was assessed using the short physical performance battery that incorporates 3 tests of lower extremity function: chair stand, 4-meter gait speed, and balance. We found that the prevalence of frailty varied widely depending on the assessment tool used. Objective tests such as the Fried criteria and the short physical performance battery had poor agreement and did not identify the same individuals as being frail or having poor physical function. This lack of agreement was also evident between our objective measures and subjective frailty ratings from nephrologists and kidney health nurses. We also found that patients perceived as frail by physicians and nurses were more likely to choose in-center hemodialysis when compared to patients who were diagnosed through objective assessment tools. In contrast, objective measures of frailty and physical function were more strongly associated with all-cause death. This important discordance between clinical perception and objectively measured frailty and physical function suggests that clinical gestalt alone is insufficient to diagnose patients as frail, and that objective measures of frailty and physical function may have prognostic value in this population.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition, or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.